If you or a loved one have trouble swallowing, it can make any mealtime scary.
Also known as dysphagia, trouble swallowing is more common amongst older adults and should be taken seriously. Have a look. Well, this is going to be a fun topic as we prepare for Thanksgiving. Going to be eating a lot. Here with us now is Dr. Amy Stratton with GI Consultants here in South Reno. Dr. Stratton, welcome to Aging and Awesome, your first time on the show. Happy Thanksgiving to you. What is dysphagia? Trouble swallowing. A lot of people deal with that.
Right, so dysphagia is essentially the medical term for trouble swallowing. There's actually 3 different types of dysphagia. One can be in the mouth, which we call oral dysphagia, and that can be troubles either chewing, so people who have bad teeth and can't chew or their dentures don't fit well, and trouble moving, like the liquid in the food, to the back of the mouth. The second type of dysphagia is called oropharyngeal dysphagia, meaning that the muscles kind of right in this area aren't functioning properly. So it could be that they're not sensing properly, it could be that they've lost their strength and they're weak, or it could be particularly what we see in the senior population is the muscle right here called the upper esophageal sphincter that connects the mouth to the esophagus where the food travels becomes really rigid and tight and doesn't relax as it should. And then the third type is esophageal, so usually kind of right in this area where the food travels from the mouth to the stomach. You can have narrowings and blockages, you can have inflammation there. All of those can cause the sensation of food sticking, particularly like an association with reflux. So the other important thing is the senior population with that muscle we talked about earlier that connects the mouth to the esophagus being really rigid, not always opening or relaxing properly. About 13% of that population will have troubles or dysfunction of that muscle.
Wow.
And that can actually be treated, but more importantly, if you have troubles there, it can lead to chronic coughing and choking with eating or drinking food. It can lead to pills getting stuck, and even at its worst case, it can have recurrent pneumonia.
So it becomes very obvious if you have dysphagia, but treatment is available. What is it like to get treatment for this if you're starting to go, wow, I'm having a hard time swallowing, I'm having a hard time eating?
Right, so the first thing that's really important is to go see a gastroenterologist because we will do a full exam, a physical, we'll get the history. It's important to know like the medical problems. So people who have had a stroke in the past, people who have Parkinson's, they're at risk for a lot of these troubles with swallowing, and that kind of narrows down what the problem may be.
So with Thanksgiving just a few days away and folks that might be watching going, wow, I'm having these symptoms, what can they do in the meantime to help alleviate some of that struggle?
Right, so a lot of it is modifying how they eat. So for example, if you know that you have bad teeth, your dentures don't fit, then getting those fixed or corrected. If you notice that you have a dry mouth, then there's things like biotin wash or different sort of lubricating washes that you can rinse and swallow or spit that can also help with the movement of food. Simple things, avoiding what you know causes the symptoms. So if you eat chicken every time and you get that dysphagia, then you probably shouldn't eat chicken.
Or turkey?
Or maybe turkey. Maybe we'll make the exception for that one since it is Thanksgiving.
Yes.
But then if you're going to do that, make sure that you take small bites, you take frequent meals, frequent small bites, and even like count to 30 each time you chew. So chew each bite 30 times to make sure that it's small and easy to swallow.
Great tips there. Dr. Amy Stratton with GI Consultants, thank you so much.
Thank you.